Welcome to the Airvo guide created by the Heat team. We will take you through all of the equipment required to commence your patient on Airvo. Firstly, select the correct prong size for your patient. The labels can assist you with choosing the correct size, where 50 to 75% of the nostril should be occluded, inclusive of any feeding tubes. The minimum and maximum flows are indicated on the packaging. Wiggle pads come included with the prongs, however as shown here they can come separately if replacements required, so see the packaging to match with the nasal prong size. Next, select the Airvo circuit, which includes blue heated tubing and humidifier chamber. Sterile water is also needed, and this will come in a sealed packet which you need to check the expiry date on. Green tubing is also needed. To set up the circuit, ensure there is an oxygen port to plug in the hose from the device. Bear in mind you will need another port for emergency oxygen use. This may be in the form of a splitter. Insert the hose into the port, ensuring that it is fully inserted, and tug back on the hose to ensure the connection is secure. Plug the device into an essential socket and keep plugged in, as the devices do not have battery life. Fit the blue tubing onto the receiver with the two pins lined up. Pull the blue cover out of the humidifier chamber and pull the water line forward. Insert the plastic elbow onto the corresponding ports. Then insert this into the blue ports. Ensure the lip is pushed down for flush connection. Push the humidification chamber in until it clicks. You should hear the following sound. Place the green tubing onto the blue nipple and flow meter. Attach the sterile water and spike the water bag. This will fill the chamber automatically. Take care not to block the ventilation area at the back of the Airvo. If there is a leak alarm, ensure this filter is inserted correctly and the blue panel fitted securely. Attach your chosen interface. Next, to input your prescribed settings, turn on the device by holding the power button. This will bring up the disinfectant screen and should always be green. If amber or red, do not use and get another device. If you see a bird and a butterfly, you're in junior mode. Press the play button once to take you to the temperature settings, twice to enter the set flow settings. Here you can change the set flow by holding the up and down arrows until the number flashes, then titrate up and down. To lock the selected flow in place, press the play button again. The play button can be used to lock the setting in and scroll through other settings. This can take you to the oxygen setting and temperature setting. Once target settings are reached, the white dotted circle will turn to a tick. To adjust the oxygen level, gently adjust the flow meter. Keep an eye on the display screen to check how much oxygen you have set. To access the back menu, hold down the silence and up and down arrows. Press play to cycle through the menu. Here the alarm parameters can be adjusted. This must only be done in conjunction with expert guidance. To change from junior to adult mode, dependent on interface, hold down the play button until the bird and butterfly fly out of view. You will be left with a white tick. Note the new target settings will be applied at this point. Alternatively, to change from adult to junior mode, complete the same steps. The device will alarm for blockages and leaks with a yellow visual display and audio alarm. Once the issue is corrected, this will stop the alarms. To fit the interface to your patient, carefully remove the backing of the inner corners and apply to the patient's face. Remove the rest of the backing to secure. Ensure the septum is not pressed on by the prongs and nostrils only 50 to 75% occluded. Please ensure nasal prongs are removed for nebulizers by peeling from the velcro and leaving the wiggle pads in situ. Once the therapy has stopped, remove the humidification chamber, water, interface, blue tubing and green tubing and discard accordingly. Remove the oxygen hose from the port. Select the red disinfectant tubing and once the device has been wiped with water and mild detergent, insert the 2-pin end of the tubing into the receiver. Insert the opposite end into the left port. Push the bung into the right port and turn the device on. The disinfection cycle will begin. The device will inform you when an air filter change is due. The air filters are kept within the heat team and on PICU. To change, open the blue panel at the back. Discard the old filter and insert the new one as demonstrated, ensuring the back is secure. Thank you for watching, and for any support get in touch with the team on the details below.
The Airvo 2 cannot be used for transfer. The Airvo 3 must be utilized and operated by trained staff only. Please be aware that new prongs have been launched. Please familiarize yourself with the information on this slide. Flows remain the same as current prongs when using the Airvo 2.